Hello and welcome to Health Professional Radio. Our guest is Dr. Ajjai Alva, medical oncologist at the University of Michigan, specializing in cancers of the bladder, kidney, and prostate. He's here today to talk with us just a bit about some of the very unique challenges that bladder cancer patients face. Welcome back to Health Professional Radio, Ajjai.
Thank you, Neal. Happy to be here.
Glad that you could return. Give us a little bit of background about yourself.
Neal, I'm a medical oncologist with a special focus and emphasis on urological or genitourinary malignancies, which include cancers of the bladder, the kidney, and the prostate, among a few others, urethra and testis being the others. And my special area of research and care here at the University of Michigan is on immunotherapies and biomarker development, so selecting the right patients for the right treatment with our ever-expanding toolbox of different tools optimized for this right patient.
Now, speaking of this toolbox, a very recent development in treatment for bladder cancer is an FDA-approved treatment that uses the body's immune system in order to combat bladder cancer. What exactly is the incidence of bladder cancer in the United States?
More than 60,000 patients in the United States every year develop bladder cancer. About 5% of them, a minority, develop widespread metastatic bladder cancer stage 4 right at presentation. But the majority present with earlier stages of disease because they develop bleeding in the urine, either seen by them, which we call gross frank hematuria, or in some cases caught on an annual exam by their physician when they order a urine test. But the majority do present on their own when they notice blood, and that, of course, naturally alarms the patients.
Mm-hmm. Are there any symptoms that can present prior to noticing blood in the urine? What are some of the symptoms that would lend themselves to early detection and more efficient treatment?
So they present almost always with blood in the urine. The little different presentations which do happen once in a while are pain or urinary infections in the bladder. And those 5% that do present with widespread metastasis, what we call systemic changes, meaning the body-wide changes of low appetite, energy loss, fatigue, weight loss, and pain in different areas, bones, liver, and so on.
Mm-hmm. Mm-hmm. Are you noticing any of these symptoms in younger patients, or is this something that presents later on in life, or does it just run the gamut and there is no method to tell who is going to be affected when?
Yeah, classically and historically, the presentation has been in the 7th and 8th decades of life. So that's because of its close association with smoking, tobacco smoking, and tobacco exposure, and a few other occupational exposure to metals, for example. But that is slowly changing, partly because of smoking patterns changing in the population, as well as to other exposures. For example, there are a few inherited syndromes of bladder cancer due to gene defects, but that is by far minority and rare. Still the biggest risk for bladder cancer, and frankly, to other parts, cancers of the other parts of the urine collecting system are smoking and smoking and smoking.
What are some of the unique challenges that a person dealing with bladder cancer deal with, as opposed to someone dealing with, say, skin cancer or bone cancer or any of the many other types of cancers out there?
Yeah, so believe it or not, bladder cancer is one of the most economically most expensive cancers among all cancer types. And that's likely because, almost for sure, because of the multiple repeated cystoscopies or scopes that are needed to evaluate the bladder, the interior of the bladder where the cancer starts. So that adds to a lot of economic burden on the patients as well as the healthcare system. And then number two, often these patients have comorbidities or coexisting diseases arising from their smoking background. The majority are smoking, not that bladder cancer cannot happen in non-smokers, it does. But a lot of these patients do have, for example, emphysema or COPD in their lungs, also from smoking. And those things add on to the challenges for the physician as well as for the patient.
Are there differences in treatment when it comes to cancers that originate in the bladder and cancer that metastasizes to the bladder and those other organs?
That's a great question again. The bladder, thankfully, does not often be the destination of a metastasis from somewhere else, so that is unusual. The most common places bladder cancer goes to are lungs, because the lungs, of course, act as reoxygenation filters in our body. Every heartbeat, a portion of the blood from the right heart, all of the blood from the right heart goes to the lungs to get oxygenated. Liver, again, one of the cleaning organs of the body. And, of course, less commonly, but oftentimes seen, we do see other areas of metastasis or spread of bladder cancer. For example, there can be brain, less common, bones, also less common, but happens once in a while. Of course, lymph nodes are immune collections called lymph nodes that occur everywhere, including around the bladder and up and down the trunk of the body, often are involved as the bladder cancer spreads. So those lymph nodes are often an easy area to biopsy and access tissue to perform some of this DNA sequencing to detect what changes are in that patient's particular tumor as opposed to bladder cancer in general. This enables us to personalize or individualize the therapy to that patient's tumor rather than a basket category of bladder cancer.
Do you find that there's more of a prevalence among men than women, or vice versa?
So historically, it has been men that have been vulnerable to bladder cancer in a ratio of 3-to-1, and that is due to the higher smoking prevalence in the men. But recently, that's been getting lower. It's not reversed, still men predominantly, but slowly because of the changing demographics of smoking trends in the society, that has changed a little bit, but still majority are men.
You know, you mentioned several scopes and things of that nature in order to conduct treatment for bladder cancer. How invasive, above and beyond the diagnostics, how invasive is treatment for bladder cancer?
So again, it goes to the stage, Neal. If it is early stage, localized only to the bladder, then oftentimes all they need is a scope, taking a look at the bladder tumor inside the bladder, and then scraping it, a procedure we call TURBT, or resection of the bladder tumor. That's all that is needed, with close follow-up. Of course, every 3 months, for example, they will need repeat scopes to keep an eye whether the cancer is coming back or not. And then secondly, oftentimes we use for localized early-stage bladder cancer instillation into the bladder of this BCG to provoke immune response against the cancer. So that is still a standard of care, or the routine modality of treatment for early stages that are not spread outside the bladder.
Have you received any feedback from patients as far as who have benefited from some of these new developments?
Yes, absolutely. And all bladder cancer doctors, including myself, have more and more patients, anecdotes to start with, but now becoming a wave of patients who I can honestly say, and with good confidence, that they're alive because of these newer classes of drugs, immunotherapies. Because the one thing immunotherapy does, as you could consider vaccines as our easiest and most commonplace kind of immunotherapy, is that you could, once you stimulate your immune system, there are cells called memory cells. So the body's immune system kind of remembers the enemy, and even if not needed at all times, like in a remission, the cancer is gone for all purposes. But if the cancer were to try to come back or recur, the immune system can get reactivated very quickly because it kind of has a memory for this cancer enemy, and it can mount an immune response sooner and more potently the next time around. So that is a hallmark which distinguishes immunotherapy from chemotherapy. Chemotherapy never could get us more effect after the chemo is done. But immunotherapy, you're kind of potentiating the immune system to keep going and maintain surveillance of the body for any possible recurrence. So we get these long remissions with immunotherapy that I can see the faces of my patients who have had, frankly, to be blunt, a second lease of life. Yeah. And there was no other options and some of my patients are out golfing in Florida because precisely of these immunotherapy drugs.
Well, it's been a pleasure talking with you. Let our listeners know where they can go online and get some more information about innovative treatments for bladder cancer and about some more of the challenges that a person dealing with this type of cancer would face.
Most validated website would be cancer.gov, which is the NCI's website for all cancers. There is a patient portal there as well as a provider physician portal. Patient portal is excellent. It is very simple to understand and does not just list the therapy options, but also goes into some of the challenges in that, as well as NCCN guidelines, the National Comprehensive Cancer Network guidelines, also has a patient aspect or perspective, which is oftentimes a good way to start reading about what bladder cancer is and what treatment options are available or may be available.
Thank you so much for talking with us again, Dr. Alva.
Thank you, Neal. Thanks for having me.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, with Dr. Ajjai Alva. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud.